Hello and welcome everybody. I'm Kathy Donaldson, the program coordinator for the Perinatal Mood Disorders Initiative at Central Jersey Family Health Consortium. We're glad that you could attend the third in our webinar series for Maternal Mental Health Awareness Month. And today we have a panel of speakers who will talk about their role in the community in promoting good maternal mental health. Each of the webinars in our series will be recorded and will be available on the Central Jersey Family Health Consortium website and also on YouTube. Please, as the speakers go on with their presentations, please put your questions in the chat, and we'll take questions for all three speakers at the end of the program. And now I'd like to introduce my colleague, Mariela Flores, who will introduce the speakers. Hi, Mariela.
Hello, good afternoon to everyone. So we'll begin first with Rachel Hansen. So Rachel is a nurse supervisor for Children's Futures Nurse Family Partnership Program. NFP, as it is known, is an evidence-based national program where nurses meet with first-time parents in their homes prenatally until about the age 2. Before coming to the Children's Futures, she worked for Mercer Street Friends Center for about 15 years. She has practiced community health nursing in Mercer County for over 25 years. Prior to that, she worked as a staff nurse at the Children's Hospital in Boston, Massachusetts. Ms. Hansen has a Bachelor's of Science in Nursing and is a graduate of Goshen College. So we welcome first Rachel.
Thank you. So good afternoon, everybody. So as Mariela said, the Nurse Family Partnership is a program for first-time moms. Clients are paired with a nurse one-on-one, meeting normally in homes. We have been doing virtual during the pandemic. The nurses are highly trained to understand what it's like to go into somebody's home and what it's like to give the clients control and their own work, definitely their worth of what they want to learn throughout the pregnancy. We meet with women. We have to meet them before they're 28 weeks pregnant, and we can stay with them up until the child is 2. It's a program where nurses step out of the role of being in charge and really believing that the client is the person that's in charge of their life and the person that is the expert on their own life. A lot of the therapeutic nature of what we do in terms of the services that we provide and how we help women with mental health is by forming a one-on-one relationship with that client. The nurse gets to know the client, is supportive of the client, and starts to listen to what the client's needs are. We also train our nurses in several tools to assess for anxiety and for depression. A lot of the times the nurses won't formally do the tool. They weave the tool into a conversation with clients and help understand where the client is at. After we've assessed the client for where they're at with depression or anxiety or whatever is going on in their lives, we start to talk to them about how they would like to help themselves. Some people want to just work with that nurse and work one-on-one, and that's absolutely fine. If they want to stick to their nurse and not seek other services, we'll support them until they're ready to make a change, move further in that process. We offer the nurses a lot of training on how to support families that are feeling anxiety or depression. We teach the nurses communication skills, which the nurse can also help with the family. I support the nurses that are dealing out in the field. I have a small caseload, but I also supervise them. So the nurses meet with me once a week and I support them, and then they get re-energized to go out and support their clients. We talk a lot to clients before they have a baby about the potential for postpartum depression. A lot of times women feel very guilty after they have a baby. If they're feeling down or depressed, they look at this beautiful baby and they think, I should be feeling wonderful. And if they're not feeling wonderful, we just help let them express their feelings. We'll give them tools to help identify their feelings, and we're just available to them to make sure that they know that they are supported and that their service is out there if they need it. The other thing that one of the really specific things that we'll do is we help families identify what their goals are. And by doing really specific, measurable, attainable goals in a time frame, we get clients to look at what they want for their life and then support them to make their own decisions to empower themselves for the future. We'll talk about goal setting with clients, but often it's just like the client will identify the goals for themselves, and then we're just kind of helping them organize them and kind of work back through, okay, so what is it that you need to do to get to that next step? Our nurses often support clients via text message after hours. Sometimes on the weekends, we'll have clients reach out to us. We don't make ourselves 100% available, and we say, like, you know, we'll answer your questions when we're available, but that support at a time when the client is feeling very alone can be really, really supportive. Another point at which we will support a client through is if there's any kind of negativity or verbal abuse going on or physical abuse, we'll support that client and we'll stay in the home, we'll make sure that they feel supported and help them get to a point where they can make healthier and safer decisions for themselves. Where we try to maintain ourselves as completely non-judgmental. We let the client make the decision when they're ready to move on to things. We provide information on things like very simple breathing techniques, very simple writing a song to get through things, and we help the client identify ways in which they are able to promote their own mental health. And it's just a really great supportive client. And I always say about the program, I think I learn as much from my clients as they learn from me. And it's wonderful to be able to be in the community. And I hope that's helpful. Thank you.
Okay, thank you so much, Rachel. Okay, so up next we have Maya Sapp. Maya is a community health worker for Healthy Women, Healthy Families for Central Jersey Family Health Consortium. Ms. Sapp has been with the consortium for approximately 3 years. Prior to becoming a community health worker, she began her career in maternal health as a case manager for the Parent Linking Program for Trenton High School students. Ms. Sapp has a Bachelor's of Arts in Psychology and is obtaining her master's degree. Welcome, Maya.
Hello, hi everyone. Thank you so much for this opportunity. Right now I'm going to begin my slideshow. So as we all know, I'm a community health worker for Healthy Women, Healthy Families, and today we're here to talk about maternal mental health. So I just want to give you a little information on Healthy Women, Healthy Families, and we focus on women providing women with services from childbearing ages of 15 to 44 years old and helping them access resources and information and referrals to local community services that will promote wellness in their families. Now for the meat and potatoes of why we're here, I would like to say that community is important with maternal mental health. So some of the causes of mental health issues in the maternal field is social isolation, economic insecurity, anxiety and fears of COVID-19, financial hardship, access to health care, and physical, intellectual, and emotional development in women children. So maternal mental health is a true public health issue that ultimately affects everyone in a whole as a family. Women are more likely to be victims of physical and sexual abuse while dealing with mental health issues such as depression or postpartum depression. Although maternal mental health has always been important to us, it's especially important right now during COVID-19. So some of the ways that community health workers and Healthy Women, Healthy Family has been promoting maternal mental health in our clients is by providing community health workers that are sufficient in knowing the resources in their community and where to go to get the help for their clients. The ASQ, which is the Ages and Stages Questionnaire, which allows parents to do a developmental screening on their child within their home, and then someone will give you a call based on your results. So it takes off the little slack of going to the actual doctor and getting a screening done on your child. And then something special we like to promote is centering pregnancy and parenting. Here in Mercer County, we have in both. Pregnancy, we have it with Capital Health, and parenting with Henry J. Austin. And this is an evidence-based maternal group that helps parents have a family of basically like a sisterhood or motherhood with children that are like the same age of their child, and they come together as a group now virtually, teaching each other about different techniques that they may have for as breastfeeding, lactation, clothing, activities, and things that they can do to keep a healthy pregnancy and parenting while they're caring for a child. And then Central Intake, which is our 24-hour hotline where you can call at any time to express your needs or any services that you may feel like you need to have during this time. And we like to say that we're bridging the connection with mothers to resources. And another special way that we're promoting maternal mental health is through our Zumba party with Healthy Women, Healthy Families. It will be on Thursday, May 27, 2021, and it starts at 10 a.m. It is free to anyone that's parenting a child. You can text or email Martha Marquez at Central Jersey Family Health Consortium or 609-451-6264. And we just would like to say that maternal mental health is very important to us, and that we love to help others and be an advocate as a community health worker to help others feel like they don't have to be alone during this time. Here are just some healthy words that we like to share with our clients, such as healthy, families, pregnancy, Mercer County, disparities, fatherhood, and transportation. Thank you all.
Thank you, Maya. Okay, so for our third and final speaker, we have Cassie. And Cassie is a senior case manager and family care coordinator at Children's Futures. She also serves as a community doula to clients who may need birth support. Before joining Children's Futures, Ms. Angu worked as a clinical and community program coordinator for a community wellness center in South Central Los Angeles. She also provided free doula services to community women who might not have had the access to services otherwise. Ms. Angu graduated in 2017 from the University of Southern California with a Master's of Science in Global Medicine, and from the University of Florida in 2016 with a Bachelor's of Science in Telecommunication. We welcome Cassie.
Good afternoon, everybody. Thank you so much for having me. So, like Mariella said, my name is Cassie Angu, and I am a doula. I have worked as a community doula for almost 2 years now, and have really been blessed to learn so much from Los Angeles and now the Trenton community here. And speaking on the topic of maternal mental health, it's been extremely crucial, I feel, for pregnant people in the community to have a doula, specifically regarding their mental health, because as everyone can imagine, and I'm sure knows here, pregnancy is not easy. And if anything, that's probably one of the times that a person might feel most taxed mentally, especially for those that have given birth or have been pregnant during this pandemic, and also for those who might have, tricky situations with their partners or with their families or with their living situations, finances, trying to navigate how to maintain or keep a job and keep money coming in, and all the many things that might be plaguing the people giving birth in our communities. Doulas can be extremely, extremely invaluable to pregnant people regarding their mental health, because I always say that most community doulas are case managers. Even though they might not have the case manager certification, they might not work as a case manager, but being a good doula means that you are well in touch with your community and the offerings that your community has. There have been countless times that I've had to refer my clients to, mental health counselors, to places in the community that have free therapy resources, wellness resources like maybe exercise and things like that. And I've noticed that my clients that do participate in those things have such a huge change in outcomes, and you can tell that it really affects them through that. I've always advocated for doulas, especially in the hospital birth or any birth setting, honestly, regarding mental health, because many clients and everybody really walks into a birthing space with all of their trauma, all of their previous experiences, all of their fears and insecurities, and many of those things are laid bare on their hospital bed when they're there. Many of my clients and many people in general, regardless of their background, are not prepared or don't realize that it can be extremely triggering to give birth, especially if your birth doesn't necessarily go the way that you would want it to go. And even if it does go the way you want it to go, I mean, as you can imagine, many people might have been exposed to many traumas, potential assaults and harassments before they become pregnant. And I've had, unfortunately, many clients where even if I go with them to their doctor's appointment or they report to me that their doctor didn't ask them, you know, could they touch them? Could they lift up their gown or lift up their shirt, or to measure their stomach, or even to do a vaginal exam? They just said, okay, I'm going to do it, and didn't really talk the client through. A lot of the time that really does affect that client's mental health. And though I'm not a mental health counselor or, you know, a therapist of any sort, I've noticed that having doulas in birthing spaces really helps clients feel empowered enough, regardless of their mental health state, to advocate for themselves, to speak up, or sometimes they will call on us as doulas to please speak up for them and advocate. I can tell a brief story about how once I had a client who had definitely suffered some trauma. Unfortunately, I do have quite a lot of stories, but we don't have enough time for me to tell you all of them. But I remember specifically that I had a client who I believe had been in a type of abusive background physically, and she had a nurse who was a bit fed up with her because she felt that she was complaining a lot about her pain management or whatever. And whenever this client had to eventually be put on oxygen just to kind of help her calm down and get her saturation levels higher, the nurse allowed the mask to slam back on her face. I could tell that my client was very, very affected by that, and it was extremely triggering to her and her mental health. And because of that, I was able to empower her to speak with the nursing staff and request a new nurse. Now, I'm sure when people think, oh, you know, you're talking about mental health, what does that really have to do with it? But honestly, I would argue that it has everything to do with it, because when a person feels powerful enough to empower themselves and know their rights, I really have seen that it has a huge difference on how that person approaches life beyond their pregnancy and outside of the birthing space, because they feel more equipped to take their treatment into their own hands, to really get what they want out of any experience that they navigate after. I've had clients who had never gone to therapy, never pursued mental health services prior to their birth. And by having a doula, and I'm not just saying that because of me, because all good doulas do this, she was able to now become someone who regularly goes to therapy. And it really is extremely empowering when a person is educated, empowered, and supported through the birthing space and throughout their reproductive life. Those things do have reverberations into their life beyond that. And I really do believe that every person should have a doula, and regardless of their background, regardless of what their pregnancy looks like, regardless of if they've had 10 children prior before they heard about a doula, I really do think that doulas can help change a person's landscape and concept of what mental health looks like and what support looks like, especially for Black women and Latinx women who unfortunately get the short end of the stick most of the time due to medical racism and just the imbalances that occur because we live in a society where there's just not that much equity or equality. So it's really important especially because Black women and Latinx women often don't get the care they deserve, you know, that there is someone like a doula or any other supportive person to help fill the gaps there with what could potentially become a long-term mental health issue if there wasn't already one there. So I would love for everybody to receive a doula. and looking forward to all the things that we're doing here in New Jersey on the maternal mental health and maternal health equity landscape. So thank you all for having me.
Excuse me. Excuse me again. Thank you to all of our speakers. Having worked in a hospital for so long, I'm not really very familiar with the services that you all provide. So I learned a lot from your presentations. What I would like to ask each of you to comment on is the stigma of mental illness among the clients that you provide care for, that you work with. Because I really see that crosses all cultures. It's not unique to one culture. I hear all the time how embarrassing it is to say that, you know, a mom has depression or anxiety, and why do I feel like this? And no, I can't get help. You know, I don't deserve to get help because of the stigma. What will people think? So can you each comment on that, please? Rachel,
Yes,
why don't you go first?
Okay. Yeah, no, I've definitely seen that over the years. I would have to say over the time that I've been in Mercer County, I've seen more people open to it. And then there's definitely stigma. That's like, I kind of de-emphasize the referral part, and we do make referrals to mental health when I talked about what the nurses do, because I think when people think they're going to get a nurse, the nurse is automatically going to say, go to therapy. And so we come at it from the approach of, we're going to support you. We're going to honor your decisions, but provide you with that information. But there's definitely stigma. There's definitely, and over the years I've seen, and I understand why there's often been a rush to misdiagnosis with children and mothers. You know, I'm not a diagnostician, I'm not the therapist, but I've had so many moms that have been diagnosed as bipolar over the years. They come off medication. They don't get rehospitalized, and often they've been misdiagnosed, and a lot of it is trauma and PTSD. Actually, I had a call from a client who graduated from Nurse Family Partnership. Her child is now 3. She reached back out to me, and we had that conversation because she moved out of state and she's struggling. And one of the things that I didn't say it to her, she was in therapy and she had been diagnosed as bipolar, and she was being told over and over again to rehash the trauma event, and that's absolutely not accurate mental health services. And I just told her, I said, I couldn't say to you, your therapist is wrong while you were going to that therapist, but I want to tell you the therapy you got wasn't right, and there's better therapists out there. And so now she's like, after 2 years, she's ready to start off on somebody else. So I think it's a combination of there's stigma, but there's also been really poor mental health, especially for less resourced and Black and Latinx women. There have been bad services offered in the past, and and as the medical community, we've got to take responsibility for that and make sure that we empower people and they get the right kind of treatment moving forward.
Maya, would you like to go next?
Yes, I would like to say, because of the nature of my job as a community health worker, with COVID-19, I have made a lot of referrals to resources for counseling services for my clients for depression. With that being said, I do feel like it is a stigma within the community, and it's sometimes based off a generational, not generational family telling you that, you know, counseling is not good, that we shouldn't do it. But with having those resources there and available, I have seen successful stories from clients actually using the resources that we provided by going to counseling services and by being consistent with the virtual counseling services that we do provide here at Central Jersey Family Health Consortium. I've seen that it has made parents more likely to want to continue counseling and to want to actually be more involved in their mental health and trying to stay healthy for their children.
Thank you, Maya. Cassie?
Yes, so regarding the stigma, I mean, we could have a whole other presentation just about the stigma in Black and Latinx communities. But I would say briefly that there's a lot of deep-rooted beliefs based, I mean, honestly, it really goes back to slavery and beyond, right? Where it's like we've had to be very strong people. And also, regardless of all, you know, if you are a white woman or an Asian woman or whatever background you're from, most women are told that they have to multitask, they have to be strong, they have to be the matriarch, they have to uphold their families. And there's not really time to be depressed, to be sad. A lot of us come from religions where we believe that if we pray or give it up to God, that we can just resolve the mental health issue. And of course, it helps, but I think that also medication is extremely taboo, used to that. A lot of people do not believe that the mind is part of the body for whatever reason. They feel that the mental portion of you is more, I guess, spiritual or not a part of the actual human functioning body, just like any person could have a vitamin insufficiency or have an issue with a function somewhere else in their body and it would need to be treated. For whatever reason, the mind isn't counted the same. And so that stigma really does follow people, especially in postpartum, when it's believed that you should be so happy to have the baby and feel blessed and feel you know, excited. And a lot of times people that are suffering from postpartum depression or anxiety aren't really feeling like that at all. They're feeling lost, confused, upset. And so the stigma comes from all of those things and is especially compounded in women, I believe. And so it's hard to tackle, but I do think that all of us that are speaking today come from do work that supports empowerment and education. And a lot of the times, empowering and educating people is the way that they start feeling comfortable enough to foray into their mental health journey. And like Rachel said, it's very unfortunate because sometimes the therapists and counselors in this community space aren't, they're not given a chance to really give the time necessary to their clients. So unfortunately, because they have such high caseloads or whatever the reason might be, they might not be able to give the time that a private insurance therapist would give to their client who was paying $150 or and above per session. And so because of that, it kind of reinforces and and keeps the cycle going of, I went to therapy and it sucked. So now I'm just going to handle it on my own, which continues to perpetuate the stigma with mental health. And that's really unfortunate because, like Rachel, I've had plenty of clients tell me, oh, I went to this and it doesn't feel like it's working. And now they've completely written off therapy, psychiatric help, or any other things like that because they're like, well, it didn't work. They weren't nice to me. And another thing, just having more therapists that look like everybody in the wellness space will really, really help reduce the stigma. Because when I told my clients, like, oh yeah, I go to therapy or I went to therapy, they're like, oh, okay. And I'm like, yeah, there's nothing wrong with me going to therapy. And there's nothing really wrong with me. I just go because I think it's good maintenance for myself. And then I think that kind of like the loss too. But if you go to therapy and you feel like you can't relate with the person for whatever reason, it does kind of help perpetuate the stigma. So.
Yep. Before we move on, I just have a question, like, and anybody can answer this. Do you think that with the virtual, I think it's made it easier for people to go to counseling? And I'm kind of wondering moving forward, like what people's thoughts are. Do you think that there will be some therapists that maintain the virtual? And is it like, has it helped more people get into services?
I would like to say that yes, it is beneficial because some of the disparities that our clients are dealing with is transportation issues. So to know that I can access therapy virtually or telehealth, it has made them want to do it even more. To know that I have to actually go to your facility and I can't get there, that puts another stressor on myself or on my clients. So I have heard a lot of success stories about the fact that they could just they can go in the bathroom, shut out the world, and go on their virtual therapy session, and it works out perfectly.
Yeah, it'll be because prior to the pandemic, insurance companies wouldn't reimburse for virtual visits. Right. And during the pandemic, everybody said virtual's paid for. And I'm hoping that there is a hybrid in the future, that we can have some in person and that we maintain some of the virtual services and that be reimbursable for practitioners in the future as well. Because I think you're right. I think it does help with some of the barriers. I mean, babysitting, transportation, going to the place, like having to walk through the door. I mean, all of those things.
Right.
Yeah. And it makes it less scary too. I think if it feels like, oh, it's a FaceTime more than an actual like medical event, or I'm going to the doctor. Because there's so much fear even surrounding just visits and appointments and things like that. So it definitely is helpful to have that virtual space available.
Absolutely.
So I talk with a lot of moms who have started therapy during the pandemic. That's the population that I work with for prevention and education. And I attended, I don't know if any of you have participated in the Rutgers Echo on social equity, but one thing that I mentioned that I thought was a barrier was having your meeting with your therapist in your car, because that's the only quiet place. You know, Maya mentioned the bathroom. That might be the only quiet private place. And I saw that as a barrier, but the facilitators of that Echo turned that right around on me and said, no, that's a great opportunity
Mm-hmm.
to have privacy. You know, that's another way that to promote good mental health. So it really turned my way of thinking around. That moms, you know, mothers are very creative individuals, and you know, to go in your bathroom or in your car, I think that's awesome. You know, get the job done. See your therapist.
Yeah, absolutely. I know Rachel and I have had clients that we've worked on together where they might be at the store. We don't even know where they're at. Keep the conversation going.
Yeah.
Yeah, I've spoken with moms as they're walking through Walmart, you know, or the grocery store, or they're at the park with their kids. And, you know, I'll talk with them for 10 or 15 minutes sometimes. And that's the most convenient time. To me, that seems, I don't like doing that. I would rather sit down and talk, but maybe they don't have that opportunity. So I've learned to be
they're very well
flexible with that.
engaged sometimes too.
Yes.
Sometimes they're just as engaged as if they were just sitting down somewhere.
Absolutely, absolutely.
And then
So
sometimes they're sitting down, the children may feel like now that's the opportunity where I can come and talk to you.
Yeah.
Even though I'm on the phone, they feel like they can just come and bombard you. But if I'm moving around, they know that I'm busy right now.
That's true. That's true. We've all seen the bloopers of the Zoom calls, right? With the parents going like, I'm on a call, I'm in a meeting, you know, this is mommy's time. Our first speaker in this webinar series, as part of her introduction, she mentioned that she had 3 spirited children. And she said, I must tell you that even though I've told them, you know, that mommy's working, that one or more of my spirited children may interrupt us. And that, you know, children aren't perfect, so we all have to allow for that. So you've spoken a little bit about the pandemic and how you've maintained relationship with your clients. Is there anything else you'd like to add about how the pandemic has influenced the care that you provide to your clients?
I would like to say that it has increased the care that I provide for my clients. When pre-pandemic, of course, we were able to go to the homes, we were able to meet them at the resources. But now that I'm not able to do that, it makes me want to be more efficient in my job and calling those resources, making sure, hey, did you all change the time that this is going to be, so that I can give this information to my clients rapidly, not, oh, we're going to meet at such and such time to do this appointment, but hey, this is the exact time that they're going to be open. You have to make an appointment. I can make the appointment for you. It has made me more efficient in my job. I feel that, but I do wish that we can go back to pre-pandemic days, but with a little twist to it.
So I would have to say, Nurse Family Partnership, we had actually created telehealth prior to the pandemic. Like we had rules and structure, because what we found is as families went back to work, we weren't able to meet with them as often. So like we had actually instituted, but you had to see them in person, like like you had to see them in person at least once every 3 months, but we could do virtual visits in between. But because we had that prior training, we hit the ground running. We didn't miss one day of visits with clients. So it was like kind of this amazing thing in terms of being able to shift over. I had to do a lot of coaching and training with my staff of getting them comfortable with video visits. A lot of people were used to the telephone, but the video visit gives you the assessment of the environment, the assessment of the mom and the children. You can put a camera down to someone's ankles and you can see swelling. You can have them push their finger and you get how much swelling there is. And so like getting people comfortable with the video, that's definitely, but I think clients have been more accessible. We've actually had an increase in the number of completed visits during the pandemic. So I would go along with what like Maya's saying. And then like the resources are faster, and then the Nurse Family Partnership has actually moved very quickly to support the nurses as they went out. They actually, in the last economic downturn, they kind of got caught out and they actually had funds available. So one of the things that we were able to do was provide some phones to clients that had lost phone service. So they did a deal with Verizon. So we got iPhones out to some of our clients and they were free to the client. And then after the phone remained with the client, Verizon donated the phones and Nurse Family Partnership paid for the service. And after the pandemic is over, they got to keep the phones, or not that it's over, but the time, they aged out at the time that they could use the phones. They paid for them for about a year. But they got to keep the phones and then just change the service over. But having that support and having those tools and that access, and we've got really good at doing door drops and doing like, you know, this client needs this and another nurse is going to be in that area. So we'll do a door drop for that client and get the different resources. I think Mercer County as a community, we've mobilized fast. I've been on some of the meetings for just like food insecurity, and that group has been tremendous at coordinating. And I think as a whole, Mercer County has really done a great job. And all of those little things end up supporting our families and making sure that, you know, they've got those nutrition needs met, and then that helps to lead to better health, and that helps mental health. And so it all ties together.
Yeah, I would say for me, it has been very bittersweet working in the pandemic, because in the doula world, it's all about community and physical touch and hugs and holding babies and massaging and cooking. And, you know, so I have been happy because I have had to learn how to be super creative. Early in the pandemic, I was sometimes meeting when they were having like, you know, no doulas allowed in birthing spaces. We were having outdoor quick park tutorials where I would teach comfort measures and massage techniques to partners or whoever was going to be the birth supporter. So that was great. It's rare that I support a birth and I don't ever see the baby, but that happened quite a few times. You know, it's really nice though, because, you know, I get to FaceTime more than I usually would. We talk. I stay on call still throughout the birth if they ever need anything. And as we slowly get back into like hybridizing in our models, it is extremely exciting because I love to be able to like hug my clients and really be hands-on, because a lot of the comfort measures do require you to touch the person. You know, you can't virtually provide pain relief to a person. And so that has been a little difficult on my end. But like I said, it's been great because we talk a lot more. I'm able to describe things. We do reenactments. I've been able to teach clients like using household items, how to do comfort measures, like a tennis ball, or, you know, or even like a wine bottle if you're doing like a leg massage or something like hard and sturdy that you could try to kind of help people roll out things. So it does, yeah, it's been interesting, but I'm very excited for us to be able to go back to hugs and not as much social distancing.
So before we end, I would just like to take this opportunity to tell everyone about the program that Central Jersey Family Health Consortium offers for mothers who may be struggling with their mental health needs. And that is a phone follow-up program. Moms can self-refer if they'd like. The information is on our website, cjfhc.org, under perinatal mood disorders. And we will work with mothers if they self-refer or if they're referred during pregnancy. We'll follow them for the remainder of the pregnancy and then up to about 3 or 4 months postpartum, calling them, texting them, emailing them every 3 to 4 weeks just to check in, see what their needs are. We don't use Zoom. Sometimes I wish that we did, because sometimes there's a disconnect between what the mom is saying and what I know her face probably looks like. And I wish that I could see them sometimes. We will connect moms with other community services, support services like lactation or central intake for diaper banks, for example, or food banks. And then we also connect them with therapists if that's something that they'd like. But mainly it's just a means to provide emotional support as birthing people transition either to the totally new role of mom with a first baby, or a mom of 2, 3, 4, 5. We've had clients up to 12 children. There is a transition. Even if you have 10 children, when you have the 11th, there's still a transition. So our number is 732-937-5437, extension 179. Or mothers can also email us at PMAD, P as in Peter, M as in Mary, A, D as in David, at cjfhc.org. And we're happy to help anyone who reaches out to us, even if it's just for education or information. I'd like to take this opportunity to thank our 3 panelists. We've really learned so much from you. It's been a pleasure working with you today. And I hope everybody enjoyed the webinar, and I hope you'll have a great rest of your week. And hopefully you'll join us next Wednesday. Thank you.
Thank you.